Now, I'm sure we are all aware that cataract is something that we have seen our parents and grandparents getting, meaning it is something that occurs when a person becomes old. But can cataract occur in younger individuals? Hello everyone, welcome back to my channel. I am Dr. PayalPandit, a board certified ophthalmologist and a cataract and refractive surgeon. In today's video, we will be discussing a very common eye condition called as cataract, which I'm sure everyone must have heard about. And what are the causes of cataract, what are the risk factors of cataract, and what are the symptoms that a patient might experience when they develop a cataract, and what are the treatment options available. So let's start with the video. What exactly is cataract? Now, in simple words, cataract is the clouding of the natural lens of the eye. However, let's break it down further. Your eye is like a balloon, and the front part of this balloon is a transparent structure which is called as the cornea. Now, behind the cornea, there is a colored part of the eye which imparts the color to your eyes. This is called as the iris. Iris has a hole in the center which is called as the pupil. Now, what happens is that the light from any object that we are seeing enters the eye through the cornea, and then it enters through the pupil, and then it reaches the lens, which is just behind the iris. Now, the lens has the function of focusing this light coming from any object onto the retina, which is the posterior most part of the eye, and it analyzes what light it is receiving, and then through the optic nerve, it sends the information to the brain. Now, what happens if the retina is not able to receive the light? This is exactly what happens when a patient gets a cataract. A cataract is basically the clouding of the natural lens of the eye, as a result of which the light rays which are passing through the cornea and through the pupil cannot actually fall onto the retina, and therefore the brain starts to see less and less, and as a result the patients experience blurring of vision. Now, I'm sure we are all aware that cataract is something that we have seen our parents and grandparents getting, meaning it is something that occurs when a person becomes old. But can cataract occur in younger individuals? Yes. So there are several different causes for cataract. Now, it can occur at any age, and there are various causes which I'm listing on the screen in front of me, and so you guys can have a look at this. Some of the commonly seen cataracts include congenital cataract, post-traumatic cataracts, cataracts as a result of certain systemic diseases, and even cataracts because you are taking certain kind of medications. However, it is impossible to describe this entire list and explain it in a single video. So I'll be making a separate video on the various types of cataract and the various causes for cataract in a separate video. So stay tuned for that. In today's video, we will be primarily talking about age-related senile cataract. So what are the risk factors for this type of cataract? There have been several studies which have shown an increased association between increasing age, female gender, increased outdoor activity, no outdoor protection in the form of sunglasses, high myopia, and certain lifestyle factors like smoking and the early development of cataract. In fact, a recent paper published in the Indian Journal of Ophthalmology is based on a study where they evaluated the prevalence, epidemiological factors, and the emerging risk factors in central India. It was a cross-sectional study which was done at a tertiary care hospital, and they evaluated more than 2,500 plus patients who had developed cataract in the past 3 years. And they found that there has been an increased incidence of cataract in patients who have certain lifestyle diseases in the form of diabetes or hypertension, and also in the case of patients who basically have smoking and tobacco usage as a part of their life. They also found that there has been an increasing trend of development of cataract in the pre-senile age group, which is less than 60 years of age. So how do you even know if you have a cataract? Well, there are certain symptoms which develop even before the vision drops. In the initial stages of the cataract, there will be a frequent change in the spectacle glass prescription. This is because the clouding of the lens causes a change in the refractive index of the lens, as a result of which there is a change in the refractive power of the entire eye. Another symptom which the patients experience is halos around the light or starburst patterns, and these are more commonly seen during night driving. And the reason for this is that when the rays of light fall onto this cataractous lens, it causes a scattering of the rays of light, and this is why they cannot focus it properly, and the light does not appear like a single point, rather it shows up in the form of halos or these starbursts. Some patients may even experience double vision or diplopia through the cataractous eye, and this affects their depth perception and balance, and they might have difficulty in dim light conditions while going down the stairs. In the later stages, most of the patients will have some degree of vision loss, and this is generally evaluated with the help of the Snellen's chart examination in the OPD. And in the final stage, the patients may be able to only perceive the light is coming. They will not be even able to see the fingers which are held in front of their own eyes. And this is the stage that we call as a mature cataract. If you are experiencing any of these symptoms, it is essential that you visit your eye care provider so that a complete comprehensive eye examination can be done for you and the best course of action can be explained. Now, moving on to the next section of the video, let us discuss some of the treatment options that are available for cataract. While there have been several claims made that some oral tablets or drops can actually cure your cataract, this is not actually true. And the only treatment that is currently available for cataract is surgery. Now, this surgery can be in the form of a small incision cataract surgery or SICS, or a phacoemulsification surgery, or a femtosecond laser assisted cataract surgery or FLACS. Irrespective of whatever type of surgery you go for, the basic simple steps of the surgery include opening up the lens capsule, removing the cataractous lens, cleaning up that same capsule, and putting the lens, a new artificial lens inside the eye. Now, this new artificial lens actually is present at the same location as the earlier crystalline lens. This new lens which is implanted can be either a monofocal lens or a EDOF lens or an extended depth of focus lens, or it can be a multifocal lens. In some patients who have certain astigmatism, a toric lens may also be used in these individuals. Cataract in today's age has become a daycare procedure, meaning that the patient will come a couple of hours before the surgery for the admission and the dilatation process. And after the surgery, they are required to stay back at the eye clinic only for a couple of hours. Anesthesia has also evolved from injection based anesthesia to only topical drops which are used during the surgery, and as a result the surgical experience is actually quite hassle free and pain free for most. I'll be making more videos on the different types of cataract surgery that I earlier mentioned, and also the different types of lenses that can be used during the surgery. So stay tuned for those videos, and if you have liked the video so far, please consider clicking on the like button and also subscribing to my channel, because this motivates me to make more such videos. Cataract is a very common eye condition which can significantly impact vision and also the quality of life of an individual. And while it is scary to undergo surgery, it is actually beneficial for the patients to get an early diagnosis and early surgery done, which will give them back crystal clear vision. So I hope you like this video, and I will see you all very soon in the next video. Bye bye.